Hi and welcome to this posture in motion routine for your upper body. So in this class we are focusing on putting function back into the upper body, and that's basically anywhere about from your navel upwards. So rib cage, really important, as you know, for good posture, good movement, preventing injuries, pain. But as humans, we rely on our rib cage for a lot of rotation, flexion, extension, and creating space in this intra-abdominal sort of container. And the shoulders as well, the collarbone area, the neck, the wrists, and the forearms. These are usually very troubled areas for so many of us. If you work out, lots of wrist pressure, you might find like you have a weak, inverted commas, upper body. Things like pulling feel really difficult. I recently went for a reformer Pilates class and I noticed that just a lot of people have issues developing stability and this ability to stack in their upper body, which means wrists over elbows, elbows over shoulders, neck is nice and sort of supported. And in order for us to get to classes that are not causing injury, we need to be doing this foundational fundamental stuff, okay? So we need 2 blocks. You're gonna need your chair. You can see that I've got foam pads under my feet to create this kind of 90-degree angle when I sit on my chair, or plyo box or stool or whatever you're going to use. I've got a strap today, and I'm also going to be using the wall for the sort of the floor part of the sequence in today's posture in motion class. So what we're going to do is we're going to get started by just coming into a nice easy seated position. And we're not going to use any props just for the first few minutes. We're just going to warm ourselves up. And we're just going to feel the base of the feet grounded. So base of the big toes, pinky toes, and the heels grounded. Palms can just be open, resting on the thighs. And I just want you to take a nice long big breath here, a couple of long big breaths just to get grounded and just to be able to sort of connect with your rib cage, your abdominals, your pelvic floor. I want you to release any bracing in the pelvic floor or the abdominals just to get started with. And as you do that, I want you to now start taking full diaphragmatic breaths in through the nose. Exhale gently through pursed lips. Once again, long big breath in. Exhaling out. As you're doing this, take inventory of what you're feeling in your body. Maybe one side feels a little bit more sticky than the other. For me, it's usually this kind of upper right side that feels a little bit more stuck, a little bit more troubled than the left. So as I'm breathing, I do feel like I have more capacity in my left rib cage, left sort of body than I do my right. I'm just being aware of this, and I want to notice how this changes over the sort of duration of the class and afterwards. Big breath in and exhaling. One more time, big breath in. Letting go of any tension in your abdominals, pelvic floor, and exhale. Good. All I'm going to get you to do is just reach your arms forwards, palms facing up, and your palms are just kind of the height of your chest, just below or in line with your clavicle. Fingers really nice and wide, thumbs pulling away from the index fingers. Try not to just extend from the thumb joint. I want you to really feel like you're pulling away from the main sort of, I don't know whether to distinguish that as the thumb joint, but this is your main thumb joint. I want you not to just use the tip of the thumb joint, the base of the thumb joint, okay? So from here, spread the fingers nice and wide, like you're holding a tray. And I want you to be really honest with yourself as to whether you're thrusting your ribs forwards here. So really feel like you're containing the ribs, keeping your abdominals and your pelvic floor really nice and relaxed. We need to be able to disassociate in order to get function into the right parts of the body, or the intended parts of the body. So fingers wide. I just want you to hold here and just take a couple of more big breaths. Exhaling, you should already start to feel like there's some sort of fatigue or something happening in the forearms, the wrists, the biceps, all the way up into the shoulders. Inhaling. keeping the feet planted, exhale. No tension in the neck. Good, and exhale. Then from here, just keeping a slight extension, right? So we're not flaring into the rib cage, we're not thrusting the body forwards. I just want you to feel like there's a slight sort of push down of the sit bones into the chair plyo box, whatever you're sitting on. Spread the fingers, spread the toes wide, feet are parallel. And we're just gonna open an imaginary sort of curtain or a door, whatever you like. Inhale, bring the arms back in. And then exhale, take them out. Good, big breath in. And as you're doing this, I want you to imagine now you've got 2 trays in both your hands or each of your hands, and you're not gonna allow the hands or the elbows to start compensating. We're not moving into the shoulders here. We're just abducting, adducting. So we're just warming up those shoulder blades, bringing them into retraction here as the arms go wide, bringing them into a slight protraction as the arms come back in. My arms are staying shoulder distance as they come in towards the body line, and they stay shoulder height as the arms go out. And if you get to about sort of 3/4 of the way and you really can't retract them any further, and you feel like you're doing that from the ribs, I want you to stop in that position. We've got one more here. And then exhale wide. Good, and then from here we're going to elevate the shoulders. So from here, most of you will just stop with this kind of a gap either side, and I want the hands still facing the back of the room. Most of you will have this like unnatural gap between your biceps and the ears. From there, I want you to start reaching your shoulders up towards the ears as if you want to touch the biceps to the ears. It's a lot. And then back down, we've got 6 here, that was 1. Exhale the arms up. Hands are going to turn and supinate, if you like, towards the back of the room. Exhale down. Inhale, reach up. So I want you to really feel like there's an elevation of the rib cage up towards the ears. Inhale down. Exhale, lift. Good, inhale down. Exhale, lift. Inhale down. Exhale, lift. Still staying relaxed in the abdominals, pelvic floor. Inhale. There will be a time when this naturally wants to contract, and that's okay. And down. Last one. Inhale all the way up. We're going to hold here. Reach up, reach up, reach up. 5, 4, 3, 2, 1. Bring the arms back down. I want you to just shake them off. Wow. Forearms should be on fire. Cool. Okay, from here, I want you to reach the hands forwards now. Same height, still staying shoulder distance. I want the arms, the hands in extension, wrists in extension, and you're going to really try and sort of corkscrew the elbow crease upwards towards the ceiling and hold here. Keep the feet planted, feet parallel, long big breath in. From here, we're going to pull the arms outwards and feel like you're trying to pull the nail beds in towards you. Inhale forwards, exhale outwards. And again, no shrugging of the shoulders up to the ears. I want you to really feel like you're pushing 2 imaginary walls out to the right and the left. Big breath in, and exhale out. A lot of feelings here. Big breath in. You can see my right arm's already starting to quiver. Exhale. Big breath in. Exhale. We've got 4 to go. Big breath in. Exhale wide. Big breath in. And exhale wide. Watch the knees. Don't let them come in or out whilst you're using this upper body. Exhale. Inhale. And exhale, hold. Big breath in. I want us to start tilting the body. So like an airplane, I want you to feel like the right hand's reaching to the floor, not floppy, but create some tension with that right arm. Left arm's reaching up. So I want you to feel like you're puffing this left rib cage out to the left side of the room. Drop the ear, the right ear to the right shoulder. Keep the left foot planted. Big breath in. Exhale to center. and then tilt to the other side on the inhale. Arms are pulling in two equal and opposite directions. Right rib cage puffs up to the ceiling. Fingers wide, hands still staying in extension. Inhaling to the right. Keep the right knee from sort of dropping outwards, right toes stay planted. Inhale to center, exhale, drop it to the left. Imagine someone's pulling the right rib, right arm all the way up. Feel this in the right sort of back of the waistline, down into the right sacroiliac crest of the pelvis. Inhale and bring the arms down. Let's shake it off. Just gonna go for a few shoulder rolls intermittently here, but be specific with the shoulder rolls. So we're going to elevate the shoulders up to the ears, lift, 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 lift. From here, I want your elbows to drive this movement. So your elbows are gonna go to the back behind you as if you're trying to pull on two sort of cables, and then pull and squeeze the shoulders together as you drop them down. Roll them forwards. As you roll them forwards, I want you to create this kind of like hunchback feeling, and then roll the shoulders up, in, down and up. Good. We're just going to go forward circles here. Reverse. Forwards, up, elbows back, down, forwards, up, back, and down. Amazing. From here, you're just going to grab a block. We're going to do this slightly more while we're standing, and then also while we're seated, okay? So holding a block between your arms widthways. I want the fingers really nice and wide and the base of the palms pushing into the block. So your thumbs are pulling up, fingers are wide. And then turn those elbow creases up towards the ceiling. This is gonna help us establish a connection between the shoulder blades and the ribs. And then from here, we're going to inhale. Keeping the feet grounded, you're gonna exhale, rotate to the right. As you're doing this, knees aren't being loosey-goosey, pelvis isn't being loosey-goosey. I want you to create an equal and opposite reaction. So shoulders move to the right, knees and pelvis feel like they're moving to the left. Big breath in, inhale, center, exhale to the left. Same thing. Big breath in, center. Keep those elbow creases turning upwards. Gentle squeeze of the block all the way through. Inhale and to the left. Big breath in, center. Exhaling to the right. Big breath in, center. Exhale to the left. Good. We're going to introduce a little bit of a standing sequence now. So from here, middle, inhale, to exhale to the right. And then as you elevate the shoulders up to the ceiling, I want you to come up into standing, just facing the right side of the room. From here, you are going to take the block, wind it down towards the right side of your pocket as you look down towards the right foot. Should be a massive feeling in this whole left side, all the way from that pelvic sort of crest all the way up into that left rib cage. From here, keep rolling yourself down towards the floor just outside your right foot. And then wind it up, inhale, block back to center, and sit back down on your chair or your box. Going to the left, exhale. Then from here, we're gonna inhale, stand up. Good, and we're going to roll down towards the left pocket. Roll it down, roll it down, roll it down. Try not to lean back into the glutes. Keep the pressure of the big toes on the floor. Rolling back up. Back to center. And sit. Big breath in. Exhale to the right. Lift. I forgot the lift on the other side. So we're going to elevate the shoulders here. We're going to stand up. Big breath in. Tuck your chin towards the throat and start rolling the spine down towards the right. Amazing. Up into standing, big breath in, back to center. sit. Feel that hinge of the hips as you sit back down. Exhale to the left and elevate. And then from here, feel like you have to reach forward slightly to stand and start curling down towards the left. It's a bit of a full body movement here, but really targeting the start from the upper body. And then up into standing. Big breath in. Back to center. We've got one more each side. Inhaling seated, exhale to the right. Elevate the shoulders and then come back into standing. Exhale, round it down. My chin is in towards the throat. I'm rounding the spine, keeping both my feet grounded. I'll only go as far as I can go. Down, 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 down. Now, from here, I want you to just plant the block, whichever height you need. So it could be on the highest setting, could be on the medius thin way, it could even be on the lowest setting. I'm going to have mine on the lowest setting. Please take whatever setting feels good for you. You are going to keep your pelvis trying to turn forwards, left hand on the block here. You're going to bring your right hand just behind the skull, take a flat surface of the palm to the flat surface of the skull, and then you're going to take an inhale here, twist to the right. Exhale, right elbow to the left. Big breath in, right elbow open. Exhale, right elbow to the left. From here, we are going to keep pressing the left fingers down on the block. Drop the left shoulder. Feel like you're picking up the right rib cage and hold. 5, 4, 3, 2, 1. Pick up your block, come back into standing. Back to center. One more time to the left. Seated, big breath in, exhale to the left. Elevate those shoulders, standing up and roll it back down. Down, 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 down. Taking whatever position with the block you can get to. If you can't even get down below the knees, that's completely fine. I would recommend just keeping the hand outside the left calf. Then from here, you switch the hands. So the right calf will come onto, right hand will come onto the outside of the calf, left hand behind the skull, and you can still go from here. So you're still getting that really good sort of upper body connection in that rotation, wherever you are. And then the whole goal is to keep the pelvis feeling like it's facing forward. So you're creating that equal and opposite effect. Then bring the right hand onto the block, left hand behind the skull. Big breath in, left elbow taps the right elbow. As you exhale, open. Left elbow to the right. Exhale and open. Inhale to the left elbow to the right. Exhale and open. Hold for 5, 4, 3, 2, and 1. Amazing. Release. Good. Let's take a bit of a break here. Just going to grab your strap. You won't need your chair, so you can just push that off and away. Okay, from here, you are going to grab your strap and just come down into a seated position on the floor with your legs long. From here, you're going to bring the strap a little bit wider than hip distance and just around the edges of your feet, or just basically around the sort of balls, not the balls, it's basically around the edges of your feet. Okay, so midpoint of the foot and around the edges of your foot. Like I said, a little bit wider than hip distance, which I'm not really used to with a strap, but we're going to do this sequence with a strap. Okay, and then all I want you to do, still needs to go a little bit wider. You can see here that my ankles are just outside my hip line, so be generous with the strap. And I would probably say start more generous than you think you need, and then maybe work into a little bit of a tighter angle here. So, sitting on the floor, legs long. If you find this difficult, by all means, put a couple of blocks under your bum. You can elevate yourself. Be aware that this might create a little bit of extension in the knee, so you could even just use a sort of really low bench or a stool. That will probably protect your knees a little bit better. So find what works for you. And then from here, we are simply going to flex into the ankles, dorsiflex by keeping the toe splay. You can see here I'm struggling with toe splay a little bit on the right side. So really feel like you can spread the toes nice and wide. Hold this position. From here, we're gonna roll the pelvis forwards very slightly. Long, big breath in, and then just elevate both your arms here, feeling the rib cage rising up, not popping forwards. There's a significant difference. I really want you to feel like you're picking the rib cage up. Palms are going to face each other, shoulder distance apart, but fingers really, really nice and wide. And what I want you to imagine is you are climbing a sort of cable. And I want you to reach the left arm up towards the ear here, followed by the right. Be really true to yourself as to what you are doing. You've got to pull the strap. So there's also a little bit of hip, pelvis, and posterior leg work happening here nicely, but also really maintaining this neutral pelvic position while we free up the ribs and the shoulders here. So we're just climbing, reaching with the right, then the left, reaching with the right, then the left, right. See how much I'm moving my rib cage. Left. And then keep the right arm up. Long, big breath in. I want you to take the left palm, face it towards the left side of the room, about 2 palms distance away outside the left thigh. Drop your left elbow in towards that left pocket. So you're creating this like hinge effect with that left palm. Left palm is pushing away. So there's again an equal and opposite sort of force between the left palm and your right rib cage. Then from here, we're going to lift that right arm up to the ceiling. We're going to reach this right arm just outside the left foot as you curl down towards the floor here, pressing the left palm away from you. Exhaling. Big breath in, reach the right arm up. Exhale, reach it down and forwards. Keeping the right butt cheek on the floor all the time, right? Reach and exhale. Good. From here, you're going to reach the left hand towards the right, but keep in that shoulder distance position. Just breathe. And now we're going to rotate the right arm towards the back of the room, open from the shoulder, right palm will face the sort of the inside. Inhale, right hand forwards. Exhale, reach it round and back. Big breath in here, round it down. Exhale, reach it back and up. Amazing. Big breath in one more time. Exhale, reach it back. Sit up and just open those arms out to the right side. Then from here, interlace the hands behind the skull. Keep pulling the strap. We're just going to go for an isometric hold. 5, 4, 3, 2, 1. Release. Here we go, other side. So right hand outside the right side of your pocket. You can see here it's about a palm's or 2 palms distance away from the outside of my right pocket. Fingers are wide. I am pushing away with my right palm so I can create this hinge into my whole body with the right elbow sort of just dropping in towards my right thigh. And then from here, I'm reaching up, 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 up with that left arm. Pulling the strap, keeping this toe splay of both my feet actually. And then from here, rounding the rib cage. So imagine you're thrusting your ribs to the left here. And reaching. Imagine someone's pulling your left fingers outside the right foot. Tucking the chin down. And then reach it all the way back up. Inhale. Good. Exhale. You can really feel the lateral hamstring, left rib cage, the subscap muscles, all the good stuff happening in that whole left side. Reach it down. Each side is different. This side's pretty tight and really hard for me. Exhaling, reach. Amazing, guys. We've got one more. Big breath in. Exhale down. Good. From here, reach the left hand. Reach the right hand. Your core and your obliques, specifically the transverse, are going to want to get involved, and that's perfectly fine. This is where we know that an automatic load is going to trigger those abdominals, and we're not just using them as a compensation, okay? So from here, big breath in, and then reach and exhale that left arm back and open. Inhale, left hand forwards. Exhale, back and open. Keep pulling the strap. The strap is doing a lot of work, especially in stabilizing that lower body, so we're not easily compensating in any way. It's no wonder I find this so hard. Exhale. Inhale down. Exhale, reach. And then from here, open wide to the left. Oh, fingers wide. Pull the left shoulder down. Turn 1 more inch. And interlace the hands just behind the skull. Big breath in. Keep turning. See what your feet want to do when you want to rotate into the ribs or the right butt cheek. It's a good telltale sign what's not quite working and perhaps why you have such difficulty in your upper body. Usually not because of the upper body, but because of something not quite doing its job in the lower body. Okay. Last little bit of the sequence. From here, we are going to come onto our bellies. Before we do that, we're just going to come a little bit close to the wall here. So we're going to maintain a sort of 1 arm's distance from the wall. With our toes tucked, we're going to come into a quadruped position. Hands are going to be sort of shoulder height, fingers nice and wide. And then from here, what we're going to do is we're going to just establish a sort of tabletop position here with our shoulders and our pelvis. Okay, so you can see here that my hands are just in line with my shoulders, fingers nice and wide. And I want you to look at your base of the index finger. I really want you to make sure that there's no gap or cupping in the base of the index fingers. And then really feel like you are turning, not the hand, but the elbow creases up towards the ceiling. So you're maybe about a leg's, maybe longer than a leg's distance away from the wall, okay? Toes are tucked, so we're establishing stability from the toes up into the pelvis. And all I want you to do is shrug your shoulders towards the wall as you maintain a neutral pelvis. So it may look like you're not doing much, but keep your head neutral so you're not looking towards the wall. Just keep your head lifted, neck lifted, and push the wall as hard as you can, but grab this force with the toes and just breathe. We're gonna hold here for 5, 4, 3, 2, 1. Now maintain the push with the left hand, reach the right hand for the back wall. Palm is facing your right palm is facing your butt cheek. So push that right palm, elevate the shoulder to the ear. 5, 4, 3, 2, 1. Right hand will replace the left. Just a quick look to make sure you're putting the right hand in the right place. And then reach the left hand back. So my head's not dropping and I'm not sinking into my shoulder joint. I'm creating resistance. My neck is pulled up. My left hand's sort of reaching back. Right palm's pushing into the wall. Right elbow crease is turned upwards. And then left hand to the wall. Right hand reaches back. Here we go. 5, 4, 3, 2, 1. Right palm to the wall. Left hand reaches back. Long big breath in. 5, 4, 3, 2, 1. Both hands to the wall, and now I want you to just drop your neck and hold. Keep pushing the wall. This is a nice release for the back of the neck. Long big breath in. Long big breath out. Long big breath in. I'm not sinking into my shoulders here. I'm creating stability as I release my neck. Exhaling. So good. Good. And then from here, you're just going to come down onto the belly, last little bit. And we're simply going to get ourselves in a position where you have your hands not with the heel of the palms to the floor, but I'm going to say for me, it's 1 palm's distance above the floor level. And then I want you to have your legs hip distance, but toes turned in, heels out. So we are completely disengaging the lower body. And again, press the palms into the wall and really feel like the root of those index fingers are not, I'm going to move my mic because sometimes it gets a bit squashed. The roots of the index fingers are not cupping, okay? And then from here, we're just going to rest the forehead down to the ground. If you find your elbows are kinking here, I want you to move further away. Be honest with yourself. And then bring the forehead down. Keep turning those elbow creases upward. No cheating in the palms. And just breathe here for 5, 4, Keep those legs completely disengaged. 3, 2, 1. Now from here, you're simply going to curl the ribs up. See if you can push the floor away. You're not going to lift the ribs. I want you to just imagine you're pushing the floor away and just lifting your forehead off the floor and hold. 5, 4, 3, 2, 1. Forehead down, big breath in. Exhaling, push the floor away, lift the forehead up. So we're not doing anything with the ribs, but they are going to feel like they're being lifted just by virtue of you picking up the neck. 5, 4, 3, 2, 1. Release the head. Good. And then from here, I want you to just place the right hand behind the flat surface of the palm, behind the flat surface of the skull. Keep pushing the left hand to the wall. Long, big breath in. And then pick up your head again. And lift that right elbow up towards the ceiling. Disengage the legs for 5, 4, 3, 2, and 1. Forehead down. Right palm to the wall. Left palm behind the skull. Long, big breath in. Exhale and lift. Push the right palm to the wall. Right elbow crease is turning upwards. 4, 3, 2, 1. Release. Good. And I just want you to pull into a nice easy child's pose just to finish. Good. So just bringing the hands long. We don't need any equipment for this. Keeping the knees, feet together. Oh, just breathe. Elbows are soft. Breathing into the back of the ribs. Feel that capacity. Feel the fuel and the function back into your upper body. Big breath in. Big breath out. Good job. From here, if you can, just sit onto your heels. If you can't, you can do this standing. Interlace the fingers up towards the ceiling. Flip the palms, invert them to the ceiling. Drop your head back and hold. Amazing. You can just stand up. And just take inventory of how you're feeling versus how you felt before the class. Shaking off your hands and your legs. Coming into a nice, easy standing position. So I did mention that I felt lots of symptoms and tightness and sort of tension in the right sort of upper part of my shoulders, neck. And there definitely seems to be some ease in that area, a lot more fluidity, lots of clicking and popping, which is probably good signs. But also I really feel like my feet are grounded. Earlier I just felt like my feet were kind of caving inwards, and that all just feels like it's nice and stable. That was your posture in motion routine for the upper body.